Now let's take a closer look at the front lines of this fight right here in New York. Dr. Arabia Mollette is in the battle. She's in it every day. She works in the emergency department of Brookdale Hospital in Brooklyn. Dr. Mollette, welcome. Thank you for joining us.
Hi, good morning.
Well, we just heard Stephanie's piece. They have an influx of nurses coming in. How badly do you guys need the help?
Oh, we certainly need the help, all right, but we are all helping each other by lifting each other up. And we are remaining strong because we have a job to do.
Yes, you do. I was looking at images inside your hospital, Dr. Mollette, and we saw it looked like plastic tarps that were taped up with tape to cordon off the COVID-19 ward. Paint the picture of what it's like inside your hospital right now.
I mean, right now is it's tough. It's pretty devastating. We are all doing the best we can to take care of our community overall, because the hospital is a part of the community and our patients is our community. And so we are doing the best we can to take care of everyone with low supplies like many other hospitals in our country. But at the end of the day, when you come into our emergency department, you still see the patients still struggling to smile, struggling to hold on. Their family members are doing the best they can to be supportive towards their family members as well as us as healthcare workers. And we're just doing the best we can. It's not easy. It is a medical war zone that we were unprepared for. And that's across nationally. It's not just at Brookdale, but we're doing the best we can.
Dr. Mollette, tell us what you need. We heard people say, doctors and nurses say they are desperately in need of protective gear. We hear some elected officials saying they hadn't heard that. I mean, tell me, what is your number one need right now in your hospital?
Again, we are low in supplies, but I've received word that we are receiving, we'll be getting more supplies soon, such as vents, gowns, gloves, bonnets that we use on our heads, protective gear overall, personal protective gear and vents.
Gear is important, but you also need to have the personnel. And we hear story upon story of doctors and nurses who are falling ill. Just give us the status at your hospital.
To be honest with you, I don't have the numbers as of yet, but I will say that we are at high risk exposure. And there have been a number of us that have fallen sick to the coronavirus. But again, we're doing our best to support each other, but I definitely don't have those numbers.
Yeah, one of the saddest things I feel like I keep seeing are a lot of these patients have to be alone kind of in their darkest hour. Their families can't be there just because of how contagious it is. You see families speaking to one another just on FaceTime. What have you seen in your hospital?
Same thing. It's the same thing. But even for us as healthcare workers, I haven't seen my family in over 2 weeks, so I have to speak to them on FaceTime because I can't expose them as well. My fiance and we sleep in 2 separate spaces. It's been tough for everyone, just including the family members as well as the families of the healthcare workers and healthcare workers themselves.
So, Dr. Mollette, when you start a day just like you're starting today and you suit up and you go into work, how do you have hope? Tell me what gives you hope this morning.
I pray. I usually pray before I start the shift. I pray during the shift. I pray after the shift. When I'm feeling tired and fatigued and frustrated, I walk out to the ambulance bay and I cry to release the anxiety, the frustration, because you see healthcare disparities. You see the pain and suffering in the emergency department. And so and also having colleagues that you can talk to. I will say that my emergency medicine department, the entire staff has been wonderful when we all have a chance to talk with each other without feeling ashamed about our anxieties, our frustrations, our concerns. And so I definitely want to give, I definitely applaud my emergency department, and the entire hospital for being supportive to us.
Well, Dr. Arabia Mollette, we want to thank you, too. We want to thank you for all the work you're doing. Savannah and I are both here thinking to ourselves, like, wow.
You really, you amaze us, Doctor. Thank you for your hard work, and we're sending you all of our love, and please pass it on to everybody you're working with.
Thank you so much. God bless.
You too. I was just thinking that as I drove in this morning, because I haven't seen the city in a couple weeks, and just just being a lonely profession, I was imagining the healthcare workers getting up early for the early shift, and how it might feel to walk into that hospital in these anxious times. And just, I think for all of us, we owe such a debt of gratitude for their courage to just get up and go right into the eye of the storm. So we got to support them in every way we can.
Yeah, and also when they come home, too, to their families and how they have to be distant even there.
Can you imagine?
No,
we have little kids, that when you
Yes.
walk in the door, they want to run and hug you, and they can't do that because they have to protect them. So they are making great sacrifices.
Yes.